We're going to get started. All right. I'd like to welcome and thank you for coming to our seminar, which is Brain Health and Healthy Aging. It's presented by the Parish Health Ministry and Stevens Ministry. My name is Valerie Nicholson, and I am with the Parish Health Ministry. I would also like to bring your attention to our website that you can find on Church Street Methodist UMC.org. And once you get in, up at the top, you'll see some tabs that say Mission, Prayer Request, Ministry. If you touch Ministry, a drop-down box comes down and it has Parish Health Ministry. Our website was recently revamped by Vicki Shelton, who's on our Parish Health staff. She's brilliant. She did help with the documents, forming some of them. And a few of the documents that we have on that are very useful, there are 9 of them. Getting the most from your health care visit, medication list, your final wishes, timeline for what needs to be done upon death. I'm not going to read them all, but they are excellent resources. You can just download those and print them out. I would like to give a big thank you to our staff here at Church Street for their assistance in helping us arrange this seminar. I also would like to introduce our planning committee, and please stand, Gabe Blake. She is the one who provides our excellent speakers, our panelists, and she also developed the PowerPoint that you see. Julie Thornburg, you have to stand too. Yes. She gets our volunteers for registration and for the greeters, and she's also in charge of the great door prizes we have this year. And I get your food again this year. I would also like to bring to your attention the 2 microphones. If y'all will please just stand clear of them. We do record our seminars, and also on our Parish Health Ministry website, we have the 2 previous seminars we've had, Living Forward, and last year's was Coping with Chronic Illness. Whoops. And our sponsors who provided our waters was from Senior Helpers. And we also have granola bars from Franklin and Kyle Elderlaw. Lastly, on your table, you're going to see these pretty pastel cards. Please give us your feedback. We want to know what topics or ways we can improve the seminar. Last year, a lot commented we need a break. So we have a break this year, a 15-minute break. Now I'm going to turn it over to our MC, Megan Dunaway.
Can you introduce Catherine for the, we did Catherine for the blessing?
Yes.
Okay. Good afternoon, everybody. It's good to see everybody out here today. Beautiful day that we have, so thank you so much for being here with us. Just wanted to introduce myself, of course. I'm Megan Dunaway. I am a 40-plus year member of Church Street, so very proud of that. But also I do work as Community Relations Director at Warning Point of Hardin Valley. We have assisted living and memory care for our community as well. But so happy to be the MC again. They must think I do an okay job because they keep asking me back. So thank you for having me again. Just a couple little things that I wanted to point out before we get started, and then we're going to have Catherine come up and give us a blessing, but just a couple little things. First of all, please do take advantage of our resource table in the back. There is a lot of great information from a lot of companies, some care partners, also community resources, so please make sure you stop by and grab some things to take home. And again, I want to thank the seminars presented by the Parish Health Ministry and Stephen Ministry. They do a phenomenal job They make this seem very effortless and seamless, and it's great information as well. And then on your table, there are a couple things. First of all, there is this planning guide from Smoky Mountain Home Health and Hospice. If you'll take a look inside, and please take it home with you, it's a great place for putting all of that important information in one place for your family, for yourself, in case you need it. Thumb through it and you'll see all of the information, next of kin, account numbers, long-term care policies, things like that. So it is a really good resource to take advantage of and to take home. You will also find cute little rubber duckies, courtesy of Alzheimer's Tennessee. Please feel free to take one of those home. They are absolutely adorable. If you see somebody with a Jeep, apparently you can give it to them as well. But they are absolutely very, very cute. And want to make sure everybody has the blue ticket. Does everybody have one of those blue tickets? Because that's what we're going to use to draw for these amazing door prizes. So if you don't have one, we can get that for you. Just let me know. But Catherine, if you wouldn't mind coming up and doing a little prayer for us. Thank you.
Thank you. Let us pray. Oh, gracious God, our spirits have been nourished this morning through worship. We thank you for this gift of food that nourishes our bodies. And we thank you for this gift of time, because our bodies are important. You created us this way. We are fearfully and wonderfully made. And to bring honor to you, we want to learn more about our bodies and how they work. And this afternoon, particularly, our brain, our minds. We know that you have made us in such a way that we continue to learn and continue to experience. And as we get older, to see things in new ways. So thank you for the presenters here who will open our hearts and our minds, our eyes to understanding how things work inside of us so that we might be better equipped to serve you and one another. Bless this time, and we pray this in Christ's name. Amen.
Thank you, Catherine. I want to introduce our first speaker, which is Kim Warnick. Kim is a seasoned care navigator, caregiver consultant, and the proprietor of Dementia Care Solutions of East Tennessee. She holds certifications as a dementia care practitioner, positive approach to care independent consultant, senior home safety specialist, as well as certificate in gerontology. Kim, welcome.
Well, good morning, or I guess good afternoon, everyone. Thank you for having me. This is such a beautiful church. This is the first time I've actually been here, so it's wonderful. I'm kind of coming full circle, I feel like. I grew up in West Tennessee at a little Methodist church, Pleasant Valley Methodist Church. I don't know if anyone knows about that. Union City? Hey, yeah. We need to talk. So Union City, I live in Farragut, so Concord United Methodist is my church now, so I know Reverend Nance and see some people here that I know. But I want to thank you for having me here today. Like I said, I've kind of come full circle here. So I'm going to talk a little bit about caregiving. Dr. Rochette, my colleague and friend, is really going to get into the nitty-gritty of our brain health and such, but I just want to share my journey a little bit with you, and then hopefully give you some tips that you hopefully will find beneficial. So, as I mentioned, I am a caregiver. I was a caregiver to my mother who had Alzheimer's. I unfortunately lost her in 2019. But before that, I was a caregiver to my father. He had some long-time illnesses, ended up battling cancer for many, many years, and lost him to cancer in 2015. So this is not new to me. I feel like I've learned a lot. It changed my entire life. I used to be in human resources, and I changed my career path because I felt God was leading me to reach out to caregivers like you here today to help you navigate the path and maybe reduce some of the stress and make it through. So we'll kind of get into, let me see if I get this right here. All right. So a little bit about what we're going to talk about today. And forgive me, I've been fighting a little bit of allergies in Tennessee here, so if I have to drink or clear my throat, forgive me, please. But we're going to define who is considered a caregiver. We're going to provide general tips for you for caregivers. We'll learn about safety, legal and financial planning, and creating a care team and self-care, which is so important, and discuss education and future care planning considerations. So I love this quote here from Rosalind Carter. Hopefully you guys have seen this before, but it says there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So that's so very true. So who is a caregiver? I can tell you, when I was caring for my parents, they were over in Murfreesboro and I was here in Knoxville. I guess I didn't consider myself actually a caregiver. I just thought the people that actually were hands-on were the caregivers. But I love this first bullet here. If you give time to help a person, you are a member of that person's care team, and so you are their caregiver. I love this picture here. This is me and my mom. This was very early on after her diagnosis. I love her smile. She's so happy here in my smile. I had no idea what I was doing and what my journey was going to be there. The second bullet, it says, you're not alone. You don't have to you're not alone if you do not have any training to be a caregiver. It's common to feel unprepared. I was not prepared at all. A few statistics: over 11 million Americans provide unpaid care for people living with Alzheimer's and other dementias. And I can guarantee those 11 million probably are just as unprepared and have no idea what to do. 70% of dementia caregivers report being stressed. I can tell you, stress just about put me in the hospital. So I'm like I said, I'm going to give you some tips that hopefully you will take with you and implement, because I did not, and it almost took me out. Caregivers of loved ones with dementia indicate substantial emotional, financial, and physical difficulties. Often, and I'm sure you've heard this, often we lose our caregivers before the person that they're caring for. So if that isn't a statistic that helps you think about taking care of yourself, I don't know what else is. And then the positive, 92% of caregivers say that caregiving is rewarding. Anybody else feel that way? It's an honor to take care of others. It's an honor to take care of those that raised us, take care of our loved ones. I can tell you, having gone the journey with both of my parents, there were many hard days, hard nights. But I have began to forget those times, and I treasure these good times, like these smiles and all the good things. So I prayed when I was going through this with my mother that God would help me find some joy in each day, and He did, and He led me through it. So I hope I can do that and help you as well. So a few tips. Preparation is the key. So what is mind-boggling to me is that we prepare for everything in our life. Like, I prepare for the presentation. We prepare for football games. Go Vols. Did anybody watch the Vols last night? I caught most of it. I had to go to bed. But we prepare for things, but for whatever reason, often we don't prepare for aging. We don't prepare for beyond. So hopefully we can give you some advice here. Again, that having conversations about the future helps you to feel better prepared for your loved one when they are no longer able to care for themselves. So we will talk about safety, legal planning, creating a care team, and then educating. So safety first. When I work with caregivers and we start talking about, planning, the first thing I say is your loved one safe? Because if they're not safe, you really don't need to be worried about everything else right now. We need to be worrying about their safety. So obviously, some of these are common sense. Ensure that the home is free of clutter and trip hazards, and install grab bars to prevent falls and slips in the bathroom. So as you probably know also, falls is what actually lands a lot of people in the hospital, and ultimately can change their entire life from that point forward. Often they're not able to come back home. So as we mentioned, I am a safety specialist. I do go in home and can do home safety assessments. And one of the things I learned in my training, they said grab bars are the new seat belts. So think about that. We implemented those seat belts back, 50s maybe? And so grab bars are the new seat belts. Get a home safety assessment. So obviously someone that's trained can come in and do that. An occupational therapist, this is something that I didn't know with my parents, that you can request, your doctor request a visit from an occupational therapist. They will come in home, do the home safety assessment, identify any hazards, make recommendations for home modifications. People want to stay at home. We want to age at home. So let's make sure the home is safe. Obviously, consider security systems and fall alert devices. If someone is living at home alone, go ahead and think about spending that extra money for those security systems and the fall alerts. As a caregiver, I was always so worried about what was going on at home. I was 3 hours away from my mom. If I couldn't get her on the phone, I was just a nervous wreck. So, think about if any of you are caregivers or caregivers that are a distance away, encourage them to get these set up. Obviously, we want to respect privacy, but we want to make sure that someone's safe. Common sense, make sure your smoke alarms are in working order and you have a fire extinguisher. You'd be surprised at how many people don't have fire extinguishers at home. So definitely think about that. Ensuring medications are being managed properly. So hopefully you all are aware of the pill packs. That makes it very easy. People often, when you have 15 medications like my mother did and was trying to manage all that herself, you can mess that up, especially if you have someone that is, working with some cognitive changes. So the pill packs are very easy, and that's something I would recommend. But again, when you're caring for someone that has Alzheimer's or another dementia, you want to make sure those medications are secured. I often see those sitting out on counters, and that's definitely a hazard. When caring for a loved one with dementia, obviously there's additional safety measures that you want to implement. Alzheimer's Tennessee, which we referenced, gave us the ducks today. They have a wonderful safety guide out on their website. It's like 80 pages long, but it definitely walks through every section in the house. But what I like about it is it also gives you the tools and the items that you could possibly purchase that can help you implement those safety measures. So I would recommend please going out there and taking a look at that. And then the last bullet, prepare for emergencies. This was something I was not prepared for. My mother ended up in the hospital. We didn't have her medicine. We didn't have any clothes. We didn't have any of her comfort items. And so I always tell everybody, prepare your bag, have a little to-go bag, put it in the trunk of your car, and just be prepared. You will appreciate that down the road. Some other topics, driving safety. That's a hard one for everybody. So there's a guide, let's see, I think I brought it here, that the Hartford has put out. I don't know if you've seen that, but it's on how to communicate with your loved one about driving safe. So if you've never seen this, definitely I can show this to you, but you can go to the Hartford's website and find that. Share your safety concerns with doctors. Ultimately, our loved ones don't want to hear it from us. right? So sometimes they need to hear it from a professional that maybe they should no longer be driving. So talk to the doctor and maybe have them request a driving assessment. Patricia Neal here in Knoxville does that, so you could always reach out to them. Consider additional transportation options. So if you are telling someone you don't need to be driving any longer, well then we need to be thinking about, what else can we do? So obviously start rallying the friends, start rallying neighbors, church members, and so on to help assist with that transportation. And then lastly, hopefully you all are aware of the Office on Aging, the volunteer assisted transportation, that I think the fee is maybe $3-4 a ride. So there are options out there, and their phone number I have listed here for you. Let's see. So next, obviously you have a wonderful resource with Gabe here, but legal and financial planning, I can't tell you how many people are not prepared. I had a blessing that my parents definitely got that prepared, and I can tell you, being a child, and that already being taken care of, it was a wonderful gift for me. So if you're not sure where to start, I saw this of swiping through on some of the other slides. The Conversation Project is a wonderful document that kind of helps you figure out where to start, how to have that conversation with your loved one about planning. The second one talks about advanced directives. In the back there, I don't know if I have it here, but there's
one in the Smoky Mountain book too.
Oh, okay. I've got little ones back there that actually fold up and can fit in your wallet. Erin, can you hold one up? It's over by the book. Yep. Yeah, there's a little one there. Yes. So those can actually fold up and put in your wallet, and I really like that because you can carry that with you anywhere and have that filled out. So definitely look at that. But there is a pamphlet, and then that little directory or advanced directive that you can put in your wallet there. The next one is talking about contacting the Office on Aging. Does everyone know about the savings checkup? Hopefully. If you haven't taken advantage of the savings checkup, definitely recommend reaching out to the Office on Aging. They will talk with you, look at your personal situation, and then make a determination, are there other benefits available out there that you're not tapping into? I tell you, I learned the hard way. Some of these things that I'm teaching you today, I just did not do. I did not reach out to the Office on Aging. I didn't do majority of these things. So unfortunately, I learned the hard way. And then the NIH has a wonderful guide. I do have that here. There's a ton of resources out there, but often caregivers don't know where they are, and they're too overwhelmed to try to find it. So, those of you that are helping others, make sure that they have, these guides, and they will get to it when they have a down moment and can focus. But this is another one. You can actually request a hard copy if you like, or you can print it off of their website as well. And then AARP has these financial workbooks. So they have one that's specific to veterans and then one for just caregivers and so on. So kind of like the document that you have on your table, it just is a guide. It walks you through everything to have prepared, and that your loved ones will have that for when they need to have it as well. So definitely legal and financial planning. Creating a care team. Obviously, you all are here and you are caregivers to someone, so I commend you for being here. But often a lot of people try to do this alone. I tried to do it alone. I didn't have any family here other than my immediate family. All my other family is down in South Georgia, so it was just me, and I unfortunately did that to myself. So when I'm talking to caregivers, I have them think about who else can be on your care team. So these kind of lists obviously are healthcare professionals. Often caregivers will say, I don't know what to do. My loved one won't sleep, or they're acting a certain way. And I said, the first thing I say, have you asked your doctor? They just don't think about it. So encourage people to talk to your doctors, nurses, therapists, assisted living staff. they're such a wonderful resource. My mother actually was at Morning Point, a wonderful place, but I wouldn't have survived had I not have that staff to help me through there. Service providers, your financial providers, your elder care attorneys, insurance agents, support groups. So again, a lot of people don't think like home maintenance company. Why would I talk to someone from home maintenance company? Well, as a caregiver, let's say you're overwhelmed and your grass is 3 feet tall and you don't have the money to pay for it. Well, maybe talk to a home maintenance company or talk to who you currently have, and I'm sure they can find some resources to be able to help you. So it never hurts to ask. Your personal team, obviously your immediate family, but often people don't even think about your neighbors. Even though they may not be very close to you and you may not talk to them on a regular basis, it is good to start leaning on them, especially when you have someone with dementia and they're still living at home. It's good that they're aware, obviously, of what the situation is should someone go out and start wandering or so on. So it's good to have them. And then obviously, as you all, clergy and members of the congregation, often people just don't tap into the support that they have right there in their own church. So I encourage people to do that. And then lastly, I have everyone make a task list. So to sit down and write out everything that they do on a regular basis, daily, monthly, and so on. And then take off the list what only you can do, and then encourage everyone else that's on this team to help step up. I know one of the slides was on how to help others and how to ask for help. So that was definitely very beneficial. But one of the things is don't forget the person that you're caring for. Involve them in creating that task list. So taking care of yourself obviously is easier said than done. Like I said, I did not take care of myself. But hopefully these questions can help you and others kind of think through it. So think about why you don't take better care of yourself. Do you feel guilty? Do you feel you don't have time? Are you afraid others are going to think that you're being selfish if you take time for yourself? So start thinking about it in a different way. Schedule your time in your day. Make the time. That's so important. We can do it. The day can get away from us so quickly. But if you will just schedule, even if it's 15 minutes, 30 minutes, it is so much better than not at all, because that stress and that pressure can really weigh on your health. So again, here's an example. Instead of saying, I don't have time to go to the doctor, consider saying, I must take care of me so I can take care of my loved ones. That's important. People don't think about that, but I often say, if you aren't here to help your loved one, then who is going to help them? Stress. Obviously, we all know what stress looks like, but emotional demands for caring for a loved one and the uncertainty of new roles, that's so hard. For me, my mother called me her mother. She thought that I was her mother. I had to make decisions that, gosh, I never thought that I would have to make, really for both of my parents, but more so for my mother. Conflicting demands. I was a director of HR. I was newly married. I had teenage kids, and I had a mother that needed me. And boy, that was tough. That was tough to try to do it all. And I thought I was Superwoman, but I wasn't. Recognize the signs of stress and know what causes you stress, and then obviously try to avoid that. Let go of what you can't change. That's something that's hard, easier said than done, but pray about that and let go of what you can't change. And join a caregiver support group. Here's another thing that I did not do. I tried, I just didn't find the right one, and then I just gave up. So on having gone through the full journey now, I see the benefits of the support groups. I know you have one here, which is absolutely wonderful. But not only do you get to bond with people that are traveling that journey, but then also you learn about resources and supports that you probably wouldn't have known about. So I can't recommend anymore the support group. Make time for stress relieving activities. Exercising is one of the most important things that they say that can help reduce the stress. Just take a walk. Get out and take a walk, and like today's a beautiful day to get out and just breathe some fresh air and take a walk. Listen to music, stretch, meditate. I don't know how many meditators we have here, but I didn't really sign up for that initially, and then now I'm like, I really can tell the benefits of it. But then laugh and have some fun. It's okay. It's a hard journey, but it's okay to laugh and have some fun. So the last thing we want to talk about, obviously, is educate yourself and prepare for future care. Learn as much as you can. Knowledge is power. That's, like I said, I completely changed the whole direction of my life because my mother was going through dementia, and I started diving and learning as much as I could about how to care for her, what was going on in her mind, and so on. So learn as much as you can, and then connect with support agencies to explore their education offerings. So obviously we have Alzheimer's Tennessee that's here and wonderful, but there's cancer support group or cancer organizations. Whatever it is that you're caring for, please reach out to those support organizations. The third bullet there, it talks about if you're caring for someone that has dementia, it is so important to keep them socially active and engaged. Keep them still coming to church. I know it becomes more and more difficult, but it is so beneficial for them to stay engaged in those social circles. Consider visiting a senior center or a senior day program. As I mentioned, I was at Concord United Methodist. I also worked at Cades, which is an adult day program there. Absolutely wonderful, wonderful program. So if you know anyone that could benefit from, one, the caregiver some respite, two, the person living with dementia would highly benefit from the socialization and support that they receive there. Then over on the next side, taking advantage of in-home care services sooner than later. How's that? A lot of people are hesitant to get that started. I know my parents, it took an act of Congress to get them to sign in, to bring in someone in. But finally, once we did, it was smooth and it was so helpful. I tell families to set it up before you're in a crisis mode. They'll say often, I'm not ready yet, I don't need to do this yet, but there may be a time, so go ahead and do that before you are in that crisis mode. Visiting assisted living, memory cares, and skilled nursing facilities. We all are aging. It's inevitable, it's going to happen. So why don't we go ahead and visit those places? Get on the wait list, know where you want to go before you actually need to go. So you can actually go to the place that you want to be at. And then when visiting communities, be prepared with a list. Often caregivers, I know for me, I went and I was so overwhelmed, I didn't know what to do or what to ask. So have prepared a list of questions so you know what to look for when you're there. And then lastly, learn about palliative care, hospice care. So many people are scared of bringing in hospice care, but those that have used it, the first thing they say is, I wish I had done it sooner. So please take advantage of that and encourage others to take advantage of that. There's supports there that is so beneficial. So just a few more additional caregiver resources. So again, the Tennessee.gov website actually has some information, the National Family Caregiver Support Program, which is a wonderful benefit. Caregiving.org has a list of resources for cancer, Alzheimer's, other diseases and so on. And then, here I go, excuse me. The National Institute on Aging Caregiving has another resource. For dementia specific, obviously I can't say enough about Alzheimer's Tennessee. There's so much information out on their website. They have caregiver workshops and so on. So definitely take a look at those. Alzheimer's Association has something called an Alz Navigator. that can help you determine, where to go and how to find support. And then Alzheimer's Foundation of America, tons of wonderful resources out there as well. So I appreciate your patience in listening to me today. I know it's hard to be in here with it being such a pretty day, but thank you for being dedicated caregivers. And I appreciate your time. Does anyone have any questions? Yes.
Now, all these websites, is there a list over there that we can?
No, but we can, she was asking if there was a,
We're gonna put the slideshow on the website, the video on the website, and then Kim also gave us a few handouts that she thought would be good for people to have. We're gonna put those on there. It takes a few weeks, but we'll get them up there.
anyone else? Well, thank you. It was a pleasure being able to speak with you today. I hope I was able to give you a little bit of information that will be helpful. So thank you so much.
Next, I am happy to present Dr. Amber Rochette. Dr. Rochette is a licensed psychologist and fellowship-trained clinical neuropsychologist. She earned her PhD in clinical psychology from Kent State and completed her clinical internship at the Veteran Affairs Ann Arbor Healthcare System, followed by a 2-year neuropsychology, these are such big words, I'm sorry, neuropsychology fellowship at the University of Michigan and Veteran Affairs Ann Arbor Healthcare System Consortium. Dr. Rochette, if you'll please join us and let's welcome her. Thank you.
Oh, but it is recording everything I say. Did not know I did that.
That's when you don't use exposition. Right.
It's translating everything.
Look at that. That was a new trick.
That was amazing.
You're good now.
Awesome, perfect. Thank you so much. Again, I'm Dr. Rochette. You can call me Amber. Mostly today I'm going to be talking about the pillars of healthy brain aging, which is a topic that is also near and dear to my heart. But to start off, I just want to introduce neuropsychology a little bit more before I get into healthy brain aging. Raise your hand if you've heard of neuropsychology. Okay. We got a few people who know, so I'm glad we're a lot who don't. So again, I'm trained as a psychologist first and foremost, and then I have specialty training in neuropsychology. This is a field of study that aims to understand the relationship between the brain and our behavior, and that includes things like our thinking abilities, our memory, as well as our emotions. And so as a neuropsychologist, we are another tool for individuals who have concerns about their thinking abilities. So we might not be the group you present to first, even though sometimes we are, but we are also often a part of the workup that you may be doing when you have a cognitive concern. So common tools for assessing a cognitive problem or a thinking problem may be going to your doctor, who would order maybe some pictures of your brain, something like an MRI, or they may even order functional neuroimaging that can tell you a little bit about how the brain is functioning. They may do a little bit of a neurological workup there in the office. They may order blood work. And maybe any of us who are on Medicare, you've maybe even done some of these cognitive screeners on a yearly basis. So neuropsychology feels a lot like the very extended version of those cognitive screeners that you might do at your doctor's office. But they're much more specific and help us to understand how you're doing with each area of your thinking, like your attention, your language, not just your memory, but how you're initially learning information. And through that evaluation, we can get a better idea of your strengths and weaknesses, And that can sometimes give us insight into what disease might be causing the problem, or things that aren't a disease and are actually quite modifiable that we can help you come up with solutions for. So we help with that diagnostic process, but we're also very much involved in making recommendations to improve our health and to help us live our best lives, which is what it's all about. So that's an introduction to what I'm doing on a day-to-day basis. But the bigger thing I'd like to talk with you about today is having a good, healthy brain. So what do we mean by healthy brain aging? We're literally referring to the brain. So we're looking at things like the actual structure. Is it the size it should be? Or are we ever seeing shrinkage in one part of the brain over another that could suggest a disease? Are we seeing changes with the vessels in the brain that might suggest something going on in the brain? We're also looking at the function. So that can sometimes, again, happen with neuroimaging and looking at how it's using resources. We might be looking at that through neuropsychology and looking at how we're functioning day to day. The brain aging portion is taking into account that we know that as we age, just like our joints and every other part of our body, our brain ages too. And there's an extent of that that is normal, right? So when you go see your doctor, they're not comparing you back to your 25-year-old self. We're saying, okay, does your brain look the way it should for your age? And I want to go through some of the pillars that can help us to have a healthy brain. And we all know there are diseases that we can get as we age, and we may think, well, that's outside of my control. And to some extent, that can be outside of our control, but there are also a lot of things we can do throughout our life that can lower the risk of disease. And even if we have a disease, they can help that disease progress at a slower rate, and that can help us to still live the life we want to be living, even if we have a disease going on in the brain. So just to touch on a few healthy brain benefits. So why should we be doing these things? One is that decreased rate of Alzheimer's disease and other dementias. We do see that when we're engaging in these healthy behaviors that we are at a lower risk. Delayed expression of diseases such as Alzheimer's disease. So there is research showing that individuals, even those who have really strong genetic predisposition for Alzheimer's disease, when they're living their life doing these healthy brain activities, they can see that maybe that disease presents 10 years later than someone who has the same risk but isn't engaging in those behaviors. Better memory and thinking skills just here in the moment. You know, we know that when we're engaging in these types of activities, even here today, we're going to be thinking at our best compared to if we're not doing them. These behaviors that I'm going to talk about can lower rates of anxiety and depression. So it's not always about what our brain's going to look like later as we age. It's right now. How do we make sure that we're living our best life? These activities also help our physical function, which we know can be a big barrier also to living the life we want to be living. And they help us to live independently. So a good way to remember some of these big pillars of brain health is what we call the EXCELS model. So this is an acronym you can use to remember exercise. The C is for consume healthy food. E for engage and learn. L for lower stress and boost well-being. And the S is for sleep. So I'm going to give you a little bit of an overview of each of these big areas of our brain health. And the EXCELS model is in order of importance. So exercise, if there is anything I could give you in pill form for your brain, it would be exercise. We know that it just has such a big bang for its buck, so to speak, for your brain health. So exercise we see is related to a reduced risk of dementia and an increased volume in the brain, meaning a bigger brain size as we age. And it's related specifically to improvement in areas like our memory, our attention, and our mental flexibility. We also know there's a dose-dependent response, meaning that the more we're getting, the more brain benefit we get. So the more exercise per week or per month per year. So to kind of drive that point home, I want to discuss a research study where they looked at the cardiovascular capacity for a group of women who were cyclists, so bikers. And they divided them into those with low fitness, medium fitness, and high fitness. And they followed them over time. And what this research saw was that 44 of the 191 women in the study developed dementia. They found that those in the high fitness group, so those getting the highest cardiovascular exercise, were 88% less likely to develop dementia when compared to the medium fitness group. Then they also saw this dose-dependent relationship where 5% of the high fitness group developed dementia, only 25% of the medium fitness group, and 32% in the low fitness group. So you could see that kind of difference by cardiovascular fitness level. They also saw the impact of delayed onset, where the individuals diagnosed in the high fitness group were around age 90 when they were diagnosed, compared to the average age of onset at 79 in the medium fitness group. So we know that exercise is a major driver of neuroplasticity and flexibility in the brain. I don't think this is terribly surprising to us. We've all known maybe our whole lives that exercise is important for our general health, but we sometimes forget what a big impact it has on the brain specifically. Some of us tend to say, well, I have a lot of conditions that get in the way, right? We know it's important, but how do we make that happen? We see that even small bouts of exercise impact our cognitive functioning even here today. So 10 to 15 minutes of exercise has been shown to have immediate impact on our memory. So, maybe if I were studying for an exam, instead of cramming for that last 10 to 15 minutes, maybe we should do some jumping jacks before our test. With that, there's a lot of ways to get good exercise. If we aren't, maybe our knees are not letting us get up and go for a walk. Maybe we're not able to do that, or our back is causing us too much pain. I would encourage us to work with providers who can help modify exercise so that we're still getting our heart rate up on a regular basis. There are a lot of chair exercises we can do, and we can do them in small bursts so that our body can tolerate them. And most of the research around brain health is usually in the area of aerobic exercise, so that getting ourselves huffing and puffing and getting our heart rate up. And we know that is hugely protective for the brain. But I do want to mention that there are other types of exercise, and we're seeing more and more research come out in these areas, including things like resistance training, yoga, tai chi. And some of the importance there, and I know Kim mentioned this too, is we're at a high risk of falls as we age. This is the number one cause of traumatic brain injury in older adults is falling. And we see that whenever we're doing weightlifting, we're doing strength training, our body can actually tense and hold up better in a fall than if our muscles are weaker and we tend to have more of kind of a flop when we fall. So strength training can be very helpful in that capacity, as well as just preventing frailty. We also see things like stretching, tai chi, be very beneficial for our balance, which can also help prevent those falls. So I don't think there's any one answer, but the variety is good. And in general, when it comes to cardiovascular exercise, research is really saying we want to hit that 2 to 4 hours per week. That sounds like a lot when you say 2 to 4 hours, but over a week, we're talking about 30 minutes per day. that can be broken into 10 minutes a few times per day, right? So like Kim mentioned, if we're scheduling it in, 10 minutes around breakfast, 10 minutes after lunch, 10 minutes in the evening, that can help us to still get that exercise our brain needs. The C in excels, again, is for consume healthy food. I particularly want to highlight the MIND diet. Can you raise your hand if you've heard of the MIND diet? Okay, raise your hand if you've heard of the Mediterranean diet. Okay, that's what I figured. We hear a lot more about the Mediterranean diet, which is actually a big component of the MIND diet. There's also a diet called the DASH diet, which is a blood pressure lowering diet some of you may have heard of. And there are some researchers at Rush University in Chicago, particularly led by Dr. Martha Morris, who took the Mediterranean diet and she took the DASH diet and studied those to figure out what are the active ingredients that seem to really be impacting our brain health. And they pulled those ingredients out to make what we call this MIND diet. And interestingly, their research showed that those with high diet adherence to this type of diet over 10 years saw a 7.5-year slowing of cognitive aging when compared with people in the lowest third of the group, meaning those who were not adhering to that diet. They're also seeing that the top third of those who are adhering to the diet over the course of 4 years had a 53% risk reduction for diseases such as Alzheimer's disease, compared to the middle third, which also had a 35% reduced risk. So we do, again, see that dose response where the more we adhere to the diet, the more benefit we get for the brain. But it's also encouraging to say, well, I could even adhere to this diet moderately and still see some boost, which is actually much more of a boost than we see for just the Mediterranean diet by itself, where we need to be much more of a high adherer to that diet to get the same benefit. Interestingly, they saw that these individuals were benefiting from this type of diet independent of other risk factors. So even those with diabetes, high blood pressure, history of stroke, obesity, these other things that we know can impact our brain health, they were still seeing a benefit. So you might say, well, what is this diet? How do I do it? This is not a caloric restriction type of diet. We're just saying, here are the foods that we should try to have more of in our diet. And they even break it down by how many servings they would like us to get per week. So as you look through, you can kind of quickly get an idea of which ones maybe are the most important. Green leafy vegetables, right? So where some diets may say, eat lots of fruits and vegetables, we know they're good for you. The MIND diet is going to say, well, yes, but also the green ones really seem to have the most power for our brain. Cruciferous vegetables, things like broccoli, cauliflower, we see good benefit for the brain. When it comes to fruits, instead of apples and bananas, they're going to say, well, it's the berries. It's the antioxidants coming from those berries that seem to really be doing good things for our brain. And luckily, those are quite enjoyable, Same with nuts. They want us eating high-fat nuts 5 times per week, or 5 servings, you could think, per week. So the diet does have a few things with stars by it at the bottom of the list. These are the things that we really want to consume in moderation. And that would include things like butter, margarine, cheese. And I know we all love our cheese. We're really talking about those whole fat cheeses. So if we can replace those more with a lower and non-fat version. Red meat, I don't think that's terribly surprising to us, or those fried foods or pastries and sweets. I want to point out, as a pastry lover who just had one for breakfast, it does say less than 5 servings per week. So they're not saying no pastries. They're just saying, let's keep it in check. Let's do it in moderation. The E is for engage and learn. I think this is one of those pillars of brain health that is often overlooked. We know that the more we're engaging in cognitive leisure activities, the better our brain does. And the idea is that we have this thing called cognitive reserve, which is that even when our brain is facing changes, maybe there's a disease, maybe we're having changes with the vessels in our brain, if we have created more connections in our brain, we've used it, we've kind of built the muscle, so to speak, it will cope better with those changes. It can be more flexible even when we're having change. And so there are certain things that give us cognitive reserve, like just being born with a high IQ, having a high education. But there are things we can continue to do throughout our life, continuing to be learners like you're doing even here today. Continuing to do things that stimulate the brain, like reading and playing games and being socially active. So, the really big thing here is this should be an activity that requires active information processing, right? So we're not talking about just watching TV. These are going to be things that challenge the brain. And so I will mention one thing Kim, who you heard speak just a moment ago, is doing in our office is she's working on several cognitive stimulation and social programs to help people activate their brain on a regular basis. And some of that is because we constantly hear people say, well, yeah, I know that's important, but it's hard to actually structure that into our day, especially for people who maybe are experiencing a disease that makes them want to withdraw a bit from activity. We want to give people the tools to do that. The L is for lower stress and boost our well-being. We know that being under high stress increases our likelihood of being diagnosed with a cognitive disorder, depression, and cardiovascular disease. So another plug towards what Kim had mentioned before, which is as caregivers, we really tend to put ourselves on the back burner. We have higher rates of depression. We're much more likely to miss our own medical appointments, right? And to put ours off till later when it's more convenient. But we actually know that this is critical for our own brain health and to make sure that we stay in a place where we can take care of others and enjoy our own lives. So just to mention a little bit of the research there, there's been some research in over 1,900 adults 70 and older. And we do see that those who are under the highest perceived stress, meaning they're reporting that they're feeling stress, were 30% more likely to go on to develop a mild cognitive change. We also know that this is true throughout our life. So even those who report stress in midlife, we see that they have a higher likelihood of going on to develop dementia later in life. So we really do have to prioritize our mental health, and some of that is what you're doing. It's being a part of a community that gives us a support system, that gives us tools to lower our stress and our anxiety and our depression. It may be reaching out to professionals, a counselor like me, maybe psychiatry is another tool that would be helpful. And I really recommend doing that and treating mental health providers more like primary care. Don't wait till it's a crisis. We can check in with mental health providers at any time and develop that really good support system. And then if something is exacerbated, you have a relationship. You know exactly who to go to, right? The last item is sleep. This is fun. We all like this one. We like to sleep well, but it can be really tough. Between us having a lot going on in our lives that can make us maybe not prioritize our sleep, or having disordered sleep. We can have sleep conditions that can make it hard for us to get really good rest. But we know sleep is a critical part of our cognitive functioning. I think we can all think of a night where maybe we did not sleep well and how we feel the next day, right? We have that immediate impact. And that is supported in research where it affects our ability to focus. It affects our ability to hold information in mind. It's called our working memory. And it impacts our memory. And this is a problem both when we're sleeping too little or when we're sleeping too much. So we see that those who are sleeping less than 5 hours per night are at 1.5 times higher likelihood of having poor memory, poor working memory, and executive dysfunction. Similarly, those who are sleeping more than 9 hours have a 1.58 times higher likelihood of developing those same issues. And that is, of course, linked to Alzheimer's disease as well. These are not part of the Excels model, but I think we can't miss them, which is just the importance of taking care of these other medical conditions that impact the brain. Anything that impacts your vessels below the neck are going to impact your vessels above the neck as well. High blood pressure is one of the biggest culprits. You know, the medications to treat things like high blood pressure, high cholesterol, I'm not a medication provider, but they're relatively well tolerated and really lower our risk. So whether we do it by diet or do it by medication, we want to do everything we can to keep those risk factors under tight control. That includes things like diabetes and also other conditions like not treating hearing loss is actually a really big contributor to our risk for cognitive dysfunction. I can't tell you the number of times I have someone say, well, I have a little bit of a hearing problem, but it's fine. And then they sit with their ear kind of turned to me through the entire evaluation. So we really want people to know the importance of treating that hearing loss. Others would be substance use, making sure that it's never too late to cut down on smoking, to stop smoking, to cut back on excessive alcohol use. And just to be mindful of other medications that can impact our thinking. One of the big culprits we see is people using Tylenol PM or over-the-counter sleep aids that have essentially that kind of Benadryl type medication in them, which we know can impact our thinking when used long-term. So I would want us, this is another reason why when we're meeting with our medical professionals regularly, letting them know if we're taking supplements or adding anything into our body that maybe they don't know about, just give them a heads up. So I just want to end on a few recommendations for you. I know you might say, well, you might assess and say, well, I'm doing most of those things. Or you might be someone who says, oh my gosh, I'm not doing any of those, and that seems like a lot to take on. I would want you to focus on picking one thing, one doable change, and implement one thing at a time. If you accomplish that one, go ahead and figure out what's the next one that seems doable, and we can add it in. A nice way to do that is to think, what's in line with my values? What fits in with my own belief system, and going from there. Part of that I'm saying focus on addition. So don't make your number one item to take pastries out of your diet. That's not fun, right? But maybe you could say, well, I actually really like berries. So instead of focusing on taking pastries out of my diet, I'm going to focus on adding the good stuff in. The earlier we start, the better, but it's never too late. I think a big myth is that either there's nothing we can do about it or that I'm already past the age where it would matter, and the research really does not support that. There's a lot we can do at any age to make a difference in our brain health. If you hate crossword puzzles, I'm giving you permission to throw them out the window. The number of people who tell me I'm doing them every day and I hate them. I mentioned.
Stress, doesn't it?
Yeah, it's not worth the stress of that. Cognitive stimulation is so important, but there's no research saying that crossword puzzles are the answer to that. There are a lot of ways to stimulate the brain. It's really about variety and getting enjoyment there. Treat our sleep disorders. If there's sleep apnea and we're snoring and choking and waking ourselves up, please, it's worth getting it treated. It really does have a big impact on the brain. And work with your professionals. Reach out if there's anything you're unsure about. There's just a large team around, and even if you reach out to our office, we can get you connected to the right person, even if we're not the right person ourselves. Anytime I give a talk, I manage to forget to bring business cards. But if you have any questions or need to reach me, this is my contact information. All right, thank you so much.
I'm gonna ask you a question.
Of course.
Can you tell them, and this is really for both of you, if someone wants to access you for either a home assessment or a cognitive evaluation, what's that first step? Do they just call? Do they have to go through a doctor? Tell us
Yeah.
about that.
So to reach Kim, just call us. You can get set up with Kim by just calling. For me, you can also just call. For insurance to cover neuropsychological evaluations, we need a referral. But if you call us, we will get your medical information and reach out to your provider for you. They're usually happy to send over a referral when we reach out. And so, yeah, that's the easiest way to go about it. If you're a professional who tends to connect other people and you have a question that you're just not sure if we're the right resource or which direction to go, that's when I would just email me directly. So if you call, you're going to reach our administrative assistant who can get you on the schedule. But if you call and ask a specific question that we need to answer, she's just going to forward it on to us. So the email is a more direct way to get in touch with us. Yeah, of course.
Thank y'all for being here together with us. This is the third year we have done this. Valerie, every year, she and I kind of look at each other, and every year I say, Valerie, you're up. We're going to do it again, and we're so glad we did. Kim was mentioning to me, she said, I wish every church did this. And I think it is great to not only have this time together, but to learn from each other and learn from our experiences. So thank you for being here, and thank you, Valerie, for leading the way. Really appreciate it.
Only with you.
Well, Parish Health Team really wanted this year to be focused on overall health. And we started talking about caregivers and caregiver resources, as well as brain health. But what we wanted this panel to really focus on are the other sides of our health. So the biopsychosocial and spiritual part of health. And you can turn that off, honey, if you want to. Mr. Aaron Blake, our technical support. Yay, Aaron. So Anthony, we're going to start with you. So Anthony, you guys know him from his work in the choir and being an usher. And one of my most fond memories of him is our first caregiver workshop. He came to the podium and he said, as a physician, I need to know what your values are, what your wishes are, especially about end-of-life care. So I always appreciated that so much and that really thoughtful approach. People talk to me about doctors a lot, and they say, I don't know how to talk to my doctor. I feel like I'm in there for 5 minutes. I don't really know what to say. Or maybe even I have this concern about my loved one. Can you tell us a little bit more about how to make those doctor visits a little bit more helpful?
Well, as a physician, I'm there to answer the questions of my patients, but also as a person, guess what? I'm a hypochondriac myself. And becoming a doctor did not make me less of a hypochondriac. It just gave me a whole lot more things to worry about. So your doctor probably understands your worries if you present, what your concern is, and so don't be afraid to reach out and ask your doctor. Make sure you have a primary care doctor, most importantly. As a family doctor, one of my jobs is to take all of the information from specialists and all, and sometimes explain that in easier language to my patients. If your doctor's not willing to listen to you, then find another doctor. That's super important. And if you're having that trouble, you may just need another doctor. Work with your doctor. Share with your doctor concerns about side effects of medication, particular treatment. As a family medicine doctor, one of my jobs is to have shared decision making with my patients. So I tell them about the options of treatment, of whatever is going on with them. And then I let them choose from among all the different options there. And because I realize that I'm not there to just mandate and lord it over you and tell you what you need to do. I'm there to give you advice and options, and together we choose whatever the best option is. One of the questions specifically related to dementia, I have a lot of people approach me and ask, they say, I'm really worried about my memory. And I say, so what kind of things are you forgetting? And one of the most common is, you know, I'm always losing my car keys. Well,
Anyone else? Anyone else?
So losing your car keys is not dementia. It's normal to not be able to find your car keys sometimes, and especially certain people are worse than others about it. What is dementia is when you have the car keys in your hand and you don't know what to do with them. So I encourage my patients to understand that dementia is that kind of memory loss. And there, you know, I appreciate Dr. Rochette's talk. Much of what she said is a lot of the things that I tell my patients as well. You specifically also mentioned about if there's concern about an elderly family member, try to speak to the doctor away from that family member. Try to pull the doctor aside. This happens all the time to me. A person will say, can I talk to you about my mom or my dad outside the room? We'll have those conversations. It's usually me who is telling the patient that they can't drive. That is easier from a physician than it is from a family member, as someone else has already mentioned. And from my own experience, my father is 78 years old, so not super old, but he has a progressive neuromuscular disease. And he got to the point to where we were all afraid to have him driving. And when my brother mentioned it to him that maybe he didn't need to drive, he got extremely angry. He'll later apologize for expressing his anger, but it's really difficult for a caregiver or a family member to tell their family member they're worried about their driving. So talk to your family member's doctor away from the patient, from your family member, so that the doctor can then be informed on how to proceed inside the room.
Is a letter ever an option? So, you know, I'm constantly with my mom. She won't let me talk to the doctor outside. Is there a way to kind of slide a letter to a physician or to the nurse? What would you suggest about that?
Yes, usually whenever that happens, it's either a letter or a patient portal email that, you know, sometimes a caregiver is the one who is also signed up with the parent on the patient portal, and you can send those messages. I always appreciate getting those ahead of time so that I can know what to expect as I'm coming into the exam.
And that becomes part of your chart, your electronic medical record, so that the physician, you know, Anthony may see hundreds and hundreds of people over the course of a week, much less a month. He may not remember that about every single person, but he's got that in the record that you can refer back to. So I really appreciate you saying that. Now, HIPAA can complicate that, but as a social worker, I want to remind you, you can tell the physician what you need to tell. The physician may not be able to speak back to you, but you can relay that information, right?
That's true.
Okay.
Yeah, and also HIPAA allows a family member to have full access to information if the family member requests that, you know, whenever they sign up as your patient. Or number two, if a person is the power of attorney, healthcare power of attorney.
Absolutely. So Anthony mentioned driving, and I already prepared Dr. Rochette that I was going, this is like, I feel like we should go dun 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 when we talk about driving. It's probably the most challenging area where people talk about not only as themselves they age, we have such a culture that really focuses on driving and independence, not even just memory, right? There are other reasons that driving may be a problem. Talk to us about that a little bit.
Sure. Yeah, memory is one problem, right? We occasionally have people whose maybe family members are saying, well, I can tell they're getting lost. I can tell, maybe they're tracking them on a GPS and can see that they're driving in funny places where they shouldn't be. But honestly, for me, some of the bigger concerns are processing speed. So our ability to react quick enough. Some signs of that can also be that you notice your family member is slowing way, way, way down to the point that it's actually concerning how slow they're driving. As well as changes with our visual processing. So we're usually thinking more about the eye, and you're like, well, I'm wearing my glasses. But all that information has to travel into the brain where we make sense of what we're seeing. And there are a lot of conditions that can affect that visual processing. We talk a lot about Alzheimer's disease just because it's really the most common neurodegenerative condition, but there are a lot of other conditions that can impact visual processing, including Alzheimer's. So there we can see issues where if you imagine a busy intersection, you're reacting quickly, but you're also taking in information about which light is yours, which lane do you need to be in, how fast is that car coming towards you. And so there's so much going on there from a visual processing perspective, as well as multitasking, right? So now not only are you monitoring the light, you're deciding, do I have room to turn, all these things. So it becomes a very, very complex process. And as a rule of thumb, when I hear a patient say, or a family member say, well, they can't manage their medications, they're having trouble managing their finances, but no worry about driving, that's an immediate red flag to me because it's harder to drive actually than it is to sort your medications, right? So that's a bit of a red flag. And so I would just want to encourage us that, statistics would tell us that most of us are going to stop driving at some point in our lifetime. And making a plan for that is a lot easier to do when we're not already worried. So the more we're having those conversations as a family early, the better. But I completely agree that you can also let your healthcare professionals be the bad guy and bring that topic up. Because as Kim had mentioned in her talk, we want independence, we want quality of life, that is our goal, all the way up until it bumps up to safety. So the only time we're restricting is when we're having a safety concern. And so that topic does come up for us on a very regular basis.
And I think you're talking to each person based upon what will work for them, based upon what their values are. For some people, it's going to absolutely make sense to say, well, Dad, you used to volunteer at the school, you wouldn't want to hurt a kid driving. That may work perfectly for one person, but absolutely be the wrong approach for someone else. So going back to what Kim said of having that team, it doesn't just have to be Gabrielle as the daughter talking to mom and saying, don't drive anymore. It can be the bad guy over there, Anthony. But there is something about a white coat. Something about white coat, you can say the same thing as the daughter says, but it means something different, right? Okay, so Pat, we heard a lot about the mind diet. We heard about the importance of that. Pat and I have talked about how often someone will come to us and say, well, I'm 80 years old, or I already have Alzheimer's. What's the point? What are some ways that people can add to their diet and improve that? Because it doesn't have to be that feudalistic approach, right?
I'm going to go and thank Pastor Catherine for her nice little children's talk today. Because I think she made a perfect inroad for me because she asked if anybody liked eggplant. And then it went on to eggplant parmesan. and then explaining what eggplant parmesan was. Well, I'll have to admit, I did the same thing with eggplant when I was a child too. But it's a prime example of how we, as individuals, perfectly know and are the experts of what we want to eat and how we want it cooked. And we have a lifelong experience. And for me, as a dietitian, I had the challenge of trying to work with people who were experts on what they knew tasted good, who knew how they wanted them fixed, and what they were willing to change in their life and what they were stubborn and weren't going to change. And so I can tell you, I met with a lot of challenges over my years as being a registered dietitian and working with people. What I would like to offer for all of you is, if you will look at dietary changes as not a have to. I mean, it is something that you will feel better and you will actually have a better lifestyle if you can change your eating habits even a little bit. Used to love to tell people when I was working, you know, pick one or two things that are suggested and try to change those things, and don't get guilty if you fail a little bit, but stick with it and try some things. And so one of the things that I'm thinking about this and reviewing the mind diet and everything, there's a lot of things that I think most Southerners would be like, oh, I don't want to do that. And I mean, I'll be honest, I was raised in a Southern home, so yes. But
Cheese, Amber mentioned cheese
cheese, oh,
earlier.
that's a big one for me. And the red meat is also something. But if nothing else, if you could focus on an example of how you can do that, if you can focus on using only the lean cuts of red meat instead of the greasy meats, and they still taste good, and there are ways to prepare them that they're healthy. And if you limit your servings to the serving size that is suggested, you can still have things that taste good, but you just may not have as much of them. Then if you look at limiting the meat's serving size a little bit, and then you look at what tastes good, let's add those berries. Can you, instead of white rice, plan ahead and cook brown rice? It takes twice as long, but it's just as good. Can you look at, okay, what vegetables am I willing to eat, and how can I increase the serving size and do it not all at once, but take one meal I'm going to increase from a half a cup to a cup of vegetables. And then when you get that down, maybe you can consider, can I do that at lunch too? You know, what can I do to make it more plant-based, healthy foods for my breakfast, instead of going through Dunkin' Donuts or Krispy Kreme or the biscuits and gravy or the biscuits and chicken or steak or whatever, egg, bacon, and sausage that is offered in the drive-thru on your way to work. It's a matter of choices, and that's not to say that you can splurge. I always told my patients a special occasion doesn't happen every night at 5 o'clock. And that's a real point.
That's right.
I mean, that was one of my, zings, but that was very important. And that if you try changes gradually, you're more able to make them work than when I used to sit down with a diabetic diet that totally threw out everybody's lifestyle, and they looked at me like, you have three faces, 3 heads, and 10 noses. You want me to do what?
Yeah.
And believe me, that happened regularly. If you can talk to them and pick a few things, and so if you can look through the mind-ask list and look for a couple of positive changes you could make and start small and then work more into it, that is the appropriate way. There are good cookbooks, there are good Mediterranean things that show you how you can fix the food so they'll taste better. And just because something is different doesn't mean that it's always bad.
Ooh, I think that could be a life lesson for all sorts of things. Just because something is different does not mean it is bad. Eggplant over there. Side note, Miss Pat gives my daughter her daily supply of okra. Iris's favorite food is okra, and Miss Pat will periodically drop off okra to the front porch. So thank you for continuing to encourage people to try different things, because I like what she said, and I think both Amber and Kim spoke to this too. There's something different about taking away. Taking away feels punitive, but adding on feels much more doable. And Catherine, I heard this said about Lent, is God makes change in 40 days. You know, if you look at about how long it takes for us to really establish a new habit, it's about 40 days. And so for the next month, think about adding one thing on. I think that was really, really good. So Kim, adding one thing on is sometimes hard for caregivers. And I will hear caregivers say, well, that's all well and good, but when am I supposed to do that? How am I supposed to do that? You said even as a younger caregiver, you know, you look back and see where maybe you could have done things differently. What would you say to yourself now? What would you say to a caregiver about that challenge?
Yeah, there's a lot that I would say, and that's why I do what I do now to help families. But I think the first thing would be to really sit down and find my people, find my team, rally the troops is what I say. But then also get involved with the organizations for whoever you're caring for. Like I said, education is power, and understanding what support is out there. And how you can deal with the day-to-day. I understand it's challenging when you're just trying to keep your head above water, but luckily we have technology where we can, you know, get online now. We can talk to people all over the country. So just connecting, but then also taking time for yourself. I know caregivers are so hesitant to take advantage of respite care. And I think that's probably...
Tell us what respite care might look like.
Yeah, so there's obviously lots of respite. I mean, it could be just someone from your church come in to sit with your loved one while you take a break. I mean, that's one of the things that, you know, I tell people, if you want to help someone, you want to help a caregiver, just go and give them, even if it's 30 minutes, even if they're still at the house, just give them a break. You know, they can handle it, I promise, for 30 minutes. But then also, you know, we have programs in church, but obviously day programs, like I mentioned, CADES, and help me here with
We
all
have CADES, which is out in Farragut, Hope Springs, which is off Clinton Highway, the Daily Living Center, which is also in North Knoxville, and Howard Circle of Friends, which is sort of in central Knoxville, but we also have some in outlying counties. Guess what? You have an awesome Parish Health Team. Raise your hands, Parish Health Team members, who can help direct you to places, or always call me. I think everyone in here has my cell phone. If you don't, come get it, and we will be your team. Like you said, you don't have to do it alone.
Yeah, I mean, that's the biggest lesson is don't do it alone. I know a lot of people want to keep everything close and not share your problems, but that's what we're here for. That's why we're here together as a church, to help each other. So, and then just respite, you know, there are some assisted livings, there are some places that offer respite care. It's okay to go on vacation, because you need that. You have to recharge, because if you don't, as you know, the stress and the weight and all that pressure can just bring you down. So I'd say it's okay to let someone watch your loved one for a little while.
Yeah. And no one's going to do it like you do. I hear that as sort of like a reason to not get help. That's okay. That's okay that they don't do it like you do. And it's okay even if you're just in the house, like she said. Many of you may not know, but if a person is under hospice care, they have access to 5 respite care days/nights a month. And that usually takes place inside of a nursing home setting. And I have family members who will say, okay, I'm going to do that 5 respite day. And I said, well, what did you do? And they said, I slept. I slept I got caught up on my sleep. But a lot of people don't access those respite care services or even care in the home. And when they finally do, they're like, oh, well, I should have been doing that all along. That was a good idea. Yeah. And so we don't have to do it alone. And I think that is sometimes we are our own worst enemies with that. Is that we get caught up in thinking that it has to be a certain way. And God gave us community for a reason. He gave us this community and those team members. So Anthony, before we I hope you all are thinking some questions too. We're gonna go to those, but sleep. We talked a little bit about sleep earlier. I just mentioned it when we were talking about the importance of respite and rest. Tell us a little bit more as a physician, what are your thoughts about sleep and overall health?
Well, there's definitely a correlation, and Dr. Rochette has already mentioned that, but a person who gets less than 5 hours per night, especially in their midlife, in the 45 to 65 age range, is twice as likely to develop dementia. And there are a lot of reasons that you may not be getting sleep as a midlife person or even as an older person. And those could be maybe your schedule, maybe you can't say no, and you have too many things on your plate. Maybe it's caregivers of it.
My husband's nodding at me right now, Anthony, okay?
Well, I'm in the same boat, so but we love what we do, but then we also need to enjoy our sleep, and that's one of the things that personally I protect. I go to bed around 8:30 or 9 o'clock, and I know that sounds like it's early, especially in the summer. I'm going to bed before it's dark, but I love my sleep, and that's one of the things that you need to do is really try to protect that sleep amount. Evaluate your duties. And also, as was already mentioned, sleep apnea itself is a risk factor for development of dementia. Maybe from the fact that it is one of the cardiac risk factors, maybe from the fact that it reduces your sleep, but there are a lot of reasons to treat your sleep apnea if you have sleep apnea. And as a person who's a spouse of a person with sleep apnea, there was nothing better than getting more sleep once that person got on the CPAP. Many of you can relate to that. So.
Absolutely, and sleep hygiene, I think, is an under-focused area when we look at sort of like our overall health. Sleep hygiene is so important, and Anthony and I were at an event together like last month, and I was like, boy, it's getting late. And I said, you must be a night owl. He goes, no, I'm normally in bed by 9 o'clock. And I was like, you're my kind of people. I love it. I do want to touch on with Pat, urinary tract infections are such a huge issue as we age, especially women who have incontinence, women who have had childbirth. Incontinence care can lead to that, but also just hydration. We are constantly telling people, drink your water, drink your water. What are some ideas for helping a person to do that?
Fluid and hydration is so important, and it's something that most people don't think about. And get in the habit. I stopped the two ladies who are on this panel when they walked in with their water bottles today, and I was complimenting them because mine is sitting on the counter in the kitchen where it was supposed to come with me. But that's exact. We have excuses, but making yourself, I got an app, so I think if you use your phone, there are hydration apps, and you can just click and it'll point how much hydration, and you can let it add it up for you. There are ways that you can use a water bottle and you know how many times a day. How many people here say water tastes awful? There are people that most people won't admit it. Yeah. But if water doesn't taste good, you can get lemons or limes or oranges. You can slice them and put them in your water bottle, or get you a quart jar and put 1 or 2 pieces of fruit in, and let the water sit overnight in the refrigerator, A, it's cold, and B, it takes on a little bit of those flavors. That's a wonderful way to make water taste better. I think it's mind over matter, and I struggle with this because I'm working to get my 64 ounces of just water in every day. And that's how much everybody needs. And if you're not drinking 64 ounces of water, that's another challenge for me to put out to you. That's really important. And you'll feel
Add that in, add that in.
Add that in. Really important. But you can't start with 64 ounces. You've got to work up from where you are and do it gradually. But you know, cucumbers, you can also use mint. You can use all types of things, even melon or something like that, just to flavor the water so that it tastes different. But the main thing is, just like everything else, conscious awareness of how much am I drinking. And if you can't remember, make yourself a reminder or have an app on your phone that you can check, so that it's just so important. And some cranberry juice, that's high calorie. If you have diabetes, make sure you maybe don't use the real high carbohydrate things. But you know, some cranberry juice can also be helpful for women, but you'd be amazed how much drinking water and not drinking anything else like sodas and things like that can also play an important role in making sure that you're hydrated.
So the irony of this is my phone, I'm watching the time and everything, my phone just lit up, drink water, because I have that app. And did you notice that Anthony had the Pavlovian response? He opened his water up and drank his water. Very good, doctor, very good. And, you know, find a water bottle that works for you. And when we look at kind of the Montessori method approach to dementia care, I am constantly at people's houses. I'm like, drink some water, drink some water, drink some water. That's annoying, and I know it's annoying when I do it. So having a water bottle with you and saying, let's cheers, let's drink our water, or tea time, you know, have a little chamomile tea in the afternoon. Make it something where it's easier to drink that water. And I'm just like them, I carry it with me all the time now. I know where every clean bathroom in East Tennessee is also, just in case you need that app, I can do that for you too. So I know that we did have some questions. Kim and Dr. Rochette were really great about keeping their presentations very general today, but I think you probably have some specific questions too. So I'm going to open up the floor to questions, not only for Kim and Amber, but for also the panel. And I am a social worker. I've worked in mental and geriatric health for 28 years. Donna and I used to work together. So if you have any questions on that, let us know too. Questions? Yes?
I have something that's not a question, but through the years I've had many patients, elderly patients, that would complain about how often they have to get up and use the bathroom in the night. And their water drinking continued from the time they got up until they went to bed. So I was often encouraging them to try to have their ounces before supper, and then just have sips to moisten their mouth and take medicine after supper, because it can greatly increase the risk of falling if they're getting up 5 times to use the bathroom in the dark, and most people don't turn on the light. So I think when you drink that water, it's really important for the elderly.
Absolutely. So what Paula spoke to was the importance of safety at night. One of the things that Kim does is she does home assessments, and that is something that they look at. I was at a mutual client's home not that long ago, and they had these little lights along the runner, and they said, oh yeah, Kim Warnick suggested that, and we put them in. It's like, yes, good job. But getting up in the middle of the night does put you at a higher risk of falls. And so what she was really speaking to is, let's front load that. Let's get a big glass of water when we wake up in the morning and drink that, but maybe about supper, let's taper it off. Good point.
I guess you just answered my question.
Uh-oh.
Tapering off the water at night,
Yes, sir.
Yes.
when you should do that.
When should you taper that water off? Maybe Anthony, you want to touch on that?
I like what she said, after dinner time, or try to get the water in before dinner time. That gives you a chance to empty your bladder as much as possible. With men, there's an extra challenge as you age of the prostate size causing difficulty completely emptying the bladder maybe. So just make sure you start that process early so you aren't having to get up in the middle of the night as all.
Yeah, good point. And this is sort of what I learned from a Eastern medicine practitioner, and he said, have a big glass of water ready for you in the morning, like a room temperature glass of water, drink 16 ounces right away, and it's a good way to front load your water too. What other questions? Yes, ma'am.
I have a question. I don't know if this makes a difference or not, talking about drinking water. Is there a benefit to drinking warm room temperature water versus cold water? I've heard mixed.
I don't know of anything. I know I like iced tea. I also like hot tea, and I think getting the liquid in either way is fine. I don't think there's a difference. Anyone else?
So my ice cold water is fine.
That's fine.
Like I like it so much ice and so cold. Okay.
Don't let the perfect be the enemy of the good.
True.
Oh, you like other questions? Yes.
One of the things we found in Parish Health Ministry is trying to help our folks understand that making plans and avoiding a crisis and having to make decisions in a hurry is so vital to healthy long-term care. And we also have realized that it takes a long time to make a decision to leave your home when safety is no longer possible at home. Would one of you speak to that a little bit, please?
I think that might be a good one for Kim to talk to, because that's kind of part of what you work people through. So can you speak to that, please?
Yeah, I think we need to change our mindset on making that move or that relocation to assisted living. I know I've heard the terminology, we say, I don't want to put them in assisted living, or I don't want to put them in a nursing home. But instead, maybe change that discussion to say, why don't we join an assisted living community? Why don't we join a memory care community? Again, it's the key is the community. They're there for support. And what I try to tell families is, again, you can't do it all yourself. So go ahead and make that transition, and then you can get back to really loving on your loved one and giving them something that those other people can't do. Let them do the hard work. Let them give them the showers. Let them take care of their laundry. So that's, yeah.
And Anthony?
I want to add something to that. As a physician, I often get a caregiver, a family member say, I promised them I would never put them in a nursing home. Please, please, please don't ever make that promise, because you're probably not going to be able to keep it. Have the conversation instead about how you will make sure that they're always safe. And that's the promise you can make to them.
Yeah, that's such a, how can I make you safe? That's such a good one. And if you have a diagnosis of some form of a degenerative disease, which statistically many of us in this room will, start early, and you can go and you can tour places. If you're not thinking that you're even going to need something 5 years from now, my friend Megan Dunaway will go and tour you, even if it's not going to be Morning Point. The virtue of that is you can have a conversation with your loved one. Ooh, I really liked that. Ooh, that was important to me. Ooh, I liked the size of that room. Ooh, I absolutely hated blah, blah, blah. That information is going to be really important to your loved ones as they have to maybe make that decision for you. And the people who do that ahead of time, when they're in a hospital situation and, you know, we've got to go and we've got to do something different, they don't have any of that sense of autonomy about it. So planning ahead, I think, can start that conversation, Joe. Anything else from the panel about? And I like what you said, Kim, it's not taking away, it's adding to.
Well, and I just want to add, I mean, times are different. You know, from when my grandmother was in assisted living or memory care back in the day, things are different. We have some wonderful communities, and as Gabe said, the key is go ahead and visit them early. So when you are ready, when you're at that point, you already know you're at the place that they choose or you choose them to be at.
Yeah. And Joe's done this, Verna's done this, they'll call me up and they'll say, hey, what's your favorite assisted living right now? And
It's always morning.
what I say is tell me more. Is, you know, what's the budget? What are the values? What's the proximity? There's a lot more to that conversation. And also there are some assisted living communities that are giant. That's not going to be a place where a person who has limited mobility should be. You know, there are some places that are much more like an apartment setting. That's not going to be ideal for someone who has mild cognitive impairment. It doesn't have to be a one-size-fits-all.
I would just add, and this is purely observational, and maybe there's a difference personality-wise in who preemptively decides to go into these communities, you know, independent living. But when I'm giving diagnoses of memory impairment, or maybe it's Alzheimer's disease, I've noticed a lot of times people who are already living in those settings tend to have less fear of, there's this, well, I am around other people with memory problems and I see that they're taken care of, they're doing fine, they're living a good life, and they can visualize that a lot easier than maybe that patient who comes in and their biggest value is just remaining home at all costs, even though they're completely isolated and don't know how they're going to make that happen. So I just want to...
Yeah, it's a little less stigmatizing, I would
Exactly.
think. And I tell this to our clients so often, is what COVID did in my industry is prove how important it is to get help early. Is because people were just hunkering down, like, I'm not going to do anything, I'm not going to get any help, there's too much of a risk, and absolutely, I get it. But what we saw was people went from home to nursing home. And there's a lot of in between. And as contradictory as it sounds, the people who get help earlier stay independent longer. Okay, what other questions?
We got one over there.
Oh, one has been.
Thanks for all your help in this difficult subject. Can somebody address the elephant in the room, is wait time and cost for getting into assisted living or independent living?
Wait time and cost for getting into independent living, assisted living. Yes, Megan Dunaway, do you want to talk to some of that? And we can talk to other parts of it too, because I think the other part of that I want to also say, Jeff, is wait time to get a diagnosis. And I want Amber, hold that thought, Amber.
I have a little bit of knowledge on this. So it's going to, of course, it always depends on several things. Cost is going to be, I'm just going to give an average, just going to kind of give an average. In assisted living, it depends, of course, on what type of room you're getting, what kinds of needs you may have. But I would say at the very low end, it's going to be about $3,500. Again, depending on several factors. And room type, it could go up to, if you're just in a single room, private room by yourself, maybe $6,000, $7,000. But that really is on the higher end if you need a lot of help. As far as wait times, we have a lot of assisted living in Knoxville, in the Knoxville area. You could go, there may not be any wait time, but you always want to be on their list ahead of time before you need it, because we could have I'm going to say a rush of people that need to move in. It kind of goes in cycles. So being prepared is going to be the most important. If you're on a wait list, it could be, the next day they may have something open up, but it also could be 6 months down the road. Typically, memory care does take longer to get into. There's a big need for that. So I would say, again, just be prepared. Go ahead of time and get on the list. Get on a couple lists if you can, so that it is available when you need it, hopefully.
Yeah, so assisted living communities, we're kind of flush with assisted living communities. That we have a lot of them in our Knox County and surrounding counties. So that one, in some ways, is a little easier, Jeff. Now, there are certain conditions that assisted living communities may not be as equipped to handle, and that's something that we can kind of have a conversation about. Nursing homes, that's a different conversation completely. Because most of the time when a person enters a nursing home, it is because they have been in a hospital setting. And sometimes you can think, okay, well, I'm going to tour all these nursing homes and these are my top 3 and I love them. Well, they may not have an opening then. And that's a challenge that I face with my clients all the time. And so that's why I say to them, everyone in Knoxville has my cell phone number, by the way, because I tell my clients, emergencies do not happen 9 to 5. If you go to the hospital on Saturday, I want you calling me, because we are going to call that discharge planner right away, and they don't work weekends, but we're going to leave them a message so when they come in at 7 in the morning on Monday, we're going to already have your list of places. So some of it is still being proactive. And, you know, we've talked about ways to pay for care sort of woven in this, and I think, Valerie, that may be something we really touch on more next year. But there are some options for paying for care. If you're interested in that, talk to me later, because that's like a whole 3-hour conversation. Now, Amber, we have lots and lots of people who specialize in neurology and dementia care, don't we? Yeah.
No. Yeah, it's a big problem. Part of me wants to say we should also be doing more to catch these things earlier, within primary care. And we know that a quick conversation is not enough to really identify a mild change in our cognition. On the other hand, we don't really have the resources to handle the people who already have been identified. So what happens is, someone starts to have a concern, and they call the places in town, and then they learn there's a 1-year, sometimes even closer to 2-year wait list to get into those places.
And by places, she means like the Pat Summit Clinic, neurology offices.
Neuroscience. And I will say on their end, they're obviously very aware of these problems and working really hard to make more room, to entice more providers to come to Knoxville and get more help. But I also want us to consider absolutely get on the list, right? The minute you have a concern, get the referral, get on the list. But in some ways, that year-long wait really builds up our expectations for what's going to happen when we get a diagnosis, when in reality, there's a lot that can already be done ahead of time, which is what we've been talking about, connecting to resources, getting a support team in place, and there are ways to do that. So first and foremost, of course, Kim, we're saying, well, if you're having a concern, go ahead and meet with someone like Kim who can get you directed in the right places for resources. A diagnosis may help. At times we need to be on certain medications, we need certain treatments. But other times we get the diagnosis, we get the med, and then your neurologist says, I'll see you in 6 months, right? And you're like, well, wait, I had a lot of expectation there. And that's because it's really these support providers who are doing the on-the-ground work to keep us living the life we want to be living. So go ahead and get connected to them. Don't forget about neuropsychology. We can also oftentimes help with that diagnostic piece, especially if maybe primary care has already done some lab work, they've already done an MRI. Your neurologist is likely to order neuropsychology anyway. Why not go ahead and get it ahead of time rather than waiting until you see them and getting it? There are a lot of social workers who can be helpful too at getting us connected to resources, getting support for caregivers, so getting us connected to therapy is huge. huge. Also, don't forget about treating all the possible things that are modifiable, because we get to neurology and that's what they want to do, is rule out all of these other things. So they're going to say, well, you have this untreated sleep apnea, so let's send you over to sleep medicine. And you treat that, and you come back and you say, well, now I still have a problem. And they say, okay, well, now there's this problem, let's treat it. So in that year wait, let's go ahead and manage all of those things that we can and get you feeling the best you can.
And I would think, Anthony, that's where your family doctor can really, in some ways, kind of lead the charge on that, right?
Absolutely. I like what you said about all the modifiable risk factors, because that's one of the things that we as primary care doctors can do to help you remain healthy. And you mentioned something about cardiovascular health that's super important. All of the things that are modifiable risk factors for cardiovascular disease are also modifiable risk factors for dementia. So stopping smoking, eating a healthy diet, all the things that we've talked about, making sure your diabetes and cholesterol and high blood pressure are in good range. Don't drink too much. We're Methodist, so I'm not going to pretend like none of us drink. But if you do, drink in moderation and choose wine over liquor or beer, it's probably a better choice. So all of those things that are modifiable are things that you can do to really impact your long-term memory and cognition long-term as you age.
Yeah. And that also kind of goes back to the mind diet. And Kim and I were at an annual conference with the Alzheimer's Association earlier this year, and I've been in healthcare a while, and it's hard for someone to get a diagnosis, and to forever we had like 2 medicines. That was all. And now I am so grateful to say we are in an era of treatment. And we are thinking now about neurocognitive disease like we think about cancer. So forever, cancer was the C word, right? We didn't say it. We didn't talk about it. Now we are destigmatizing, or trying to destigmatize, Alzheimer's disease. We have put a lot of focus into early intervention, diagnosis. And now we are looking at brain functioning like we think about a tumor, right? You've been diagnosed with cancer. The goal is we're going to keep that tumor from growing. We're going to keep that tumor from spreading. And so a lot of the lifestyle changes, the interventions that were mentioned, are really about how can we continue to live well with an illness. Whether that be cardiovascular illness or brain illness, how can we make these changes so that we can live as independently as possible for as long as possible? We have time for maybe 1 or 2 more questions. We've got one over there. Run, Megan, run.
Don't fall.
Don't fall. Yes.
Amber, you mentioned depression and cognitive issues. Depression that is well controlled with medication, is that an issue still, or if it's controlled, does it go away?
As far as the risk for cognitive impairment, there's still a risk associated, but we know that the more that's managed, the more we're lowering our risk. We do see increased risk really with multiple episodes as well of depression. So even though there's some risk with mild depression, we know the importance of treating it is that you're still lowering risk, even if you're not lowering it to 0.
Mm-hmm. And let's also touch about mental health. Mental health is health, right? It is health. I heard my kids laugh at me because I look at these little reels on Instagram, and one said, if a Mercedes can break down and still be a luxury car, so can you. Right? You can still break down and still be awesome, still have value, still have worth, and you can still break down. So to anyone on the panel who wants to jump in here, what are some ways to address mental health? What are some resources for that?
I always want to start with the stigma around counseling. I think some of us have the stigma about having a diagnosis period, so we have to work through that. But the next big issue I see is people really opting for a medication, maybe first, if not in complete exclusion of counseling. And we know that medications can help. We know counseling can help. When we put them together, we see the biggest benefit. And counseling comes without the risks of putting a substance in our body, which doesn't come without other side effects, right?
Wait, say that one more time, because I think that's important. Everyone needs to hear that again. Say that one more time.
Medications are important. They help, but they come with their own side effects. And so if we had a solution that didn't take putting something else in our body, maybe we need to try that first. Not everybody. Sometimes it's severe enough where we have to get the medication on board right away. But I think of that medication as treating the symptoms, not the underlying cause. A lot of times, where if we think of our typical depression, if we can rewire the way we're thinking, if we can rewire our behaviors, we can sometimes see a lasting benefit that doesn't require ongoing medication. So again, I said earlier, I don't want us to think of therapy as something we do when all else fails. I want it to be our primary care. I want it to be the first thing we try. And that's true for caregivers as well. You don't have to have a full-on, depressive episode or, an anxiety disorder to deserve support and to deserve help. And counselors are really amazing at that. And for caregivers, a lot of what we're doing is teaching how to solve those problems preemptively that come up with our loved ones, and observing their behavior and saying, it actually, the problem exists at step C, but it really started all the way back here at step A, and figuring out how to intervene there. So therapy can do a lot more than just treat a disorder. We can help with stress, we can help with sleep and insomnia, we can help with chronic pain, all of these other things. So just don't neglect that service.
Absolutely. And Anthony, medicines are also important too,
But
right?
as a physician, I could not agree with you more. That needs to be the first and cornerstone of treatment of depression, anxiety, having a good counselor on board. I always expect that and desire that first for all of my patients. When medications become necessary, your doctor can help decide which one is best for your situation. For example, sometimes an expression of a person's anxiety or depression is a physical symptom like pain or gastrointestinal kinds of issues or something like that. So everything that is a physical symptom is not necessarily caused by a physical thing. It can be caused by this psychosocial kind of issues. And so certain medications help treat that kind of symptom a little bit better than others. But again, counseling is number one. That has to be a huge part of however you're treating mental illness of any kind, but especially depression and anxiety.
And counseling can take lots of different forms. I mean, you can be in a support group. That can be a form of counseling. And Stephen Ministry, while not counselors, they're the first ones to say, we're not healthcare professionals, we're not mental health professionals, they are support. There are telehealth services for seeing counselors. There's all sorts of different options, but really that's important. And, Pat and I were like nodding to each other because there's a huge area of medicine right now that's studying the importance of gut health and what we put into our body and how that affects not only cognition, which we've been talking about here, but also just our emotional health too. We are what we eat, right, Pat?
I was getting ready to say that you have to remember, if you are depressed, if you are having anxiety, take the time to look at your diet. And if your diet and exercise has fallen off the regular path and into the muddy path, any change you can make, small but steady, can help, because if you are what you eat, And if you put garbage in, you get garbage out. And if you eat healthy, you can start feeling better. So diet and exercise are two keys to this. And a lot of times people want to take a pill, but it's getting counseling and it's looking at overall wellness, and nutrition and exercise play a role in that.
And doctors say, you know, a lot of people say, well, my doctor just gave me a pill for it. Your physicians, your healthcare team, I hope I'm speaking here for you in saying this, they want you to have all of these resources. Like Anthony said earlier, we need to know what your goals are, and we're going to make steps for that. So yes, it might be medication, but also these other lifestyle changes too. Did I see a question back in the back? Someone raised their hand.
I think there's been one here.
One here. Emily, did you have a question? No, didn't have a question.
One thing I wanted to add to that is avoid treating your symptoms yourself with some kind of substance, be it some kind of drug, either prescription drug or illegal drug or alcohol or something like that, because that just leads to worsening of depression. It doesn't help.
Such a good point. Yes, ma'am.
I think often when a patient, particularly an elderly person, is admitted to the hospital, the medical doctor has that list of the medicines that they're on, but the family may have not told the physician in primary care about the psychotropic drugs they're on, and so they just kind of get dropped. So it's so important for the family to really be overseeing that list. I have a patient that had been a very severe bipolar patient who had been stable on 200 milligrams of Seroquel XR for 15 years. Now, just think about this. He'd been stable on this same medicine for 15 years, but when he was in the hospital, he was having a hypotensive crisis where his blood pressure was dropping. What did they do for it? Canceled his Seroquel. Maybe in somewhere they read that it could lower the blood pressure, but if it hadn't been 15 years, that probably was not the cause, and it totally destabilized him. And I've seen that happen very often. It just those medicines may be left off the list, or that's the first they want to omit.
So this is kind of two parts. Your physicians, like you said, they need to know your medicines, your over-the-counter medicines, herbal supplements, but it kind of also goes back to some of the safety things that Kim said and having that go bag. How could you speak to that about medicines for having that go bag ready?
Well, before we get to that, I just want to say, as caregivers, it's important to be an advocate for the person you're taking care of. So again, having these conversations that we keep on talking about and knowing their medications and so on. But sometimes you have to challenge doctors and say, I don't agree with this. Explain to me a little more. But the go bag, yes, I mean, it's so important, because again, you can have in that go bag, have their medications, have the list of medications and everything, and then just those comfort items. Like I said, I learned the hard way having to go to the hospital, and then when you can't leave the hospital and there's no one else to bring it to you, I sure wish I'd had that. So.
I'll go ahead and speak to that a little bit more. That's where it's very important to have a primary care doctor. Sometimes people have a specialist for this, specialist for that, a psychiatrist or whatever, but don't have a family doctor to pull it all together. And one of the things that we do, every time a patient comes in to my office, and most of my job is teaching residents, new doctors. I did primary care in my own practice for almost a decade, and then I came to Knoxville, and I've been teaching ever since. But I teach our residents that one of the things that we have to do is make sure we have an accurate medication list every single time your patient walks in the door. Because what if the symptom they're having is a side effect of a medication you don't know about, or an interaction with something you're getting ready to give them? And so that's super important. Have a primary care doctor to help pull all this together.
And don't forget those injections. You have those 2 times a year injections for your bone health or infusions. Don't forget to mention those too. Well, thank you so much, panel. This has hopefully been helpful to you all today. We are absolutely blessed in our church to have so many people who are really dedicated to being that team that Kim talked about. So if you have questions, you can see me or Valerie, Verna, raise your hand, Joe, raise your hand. We can help to link you to resources as needed, and Megan's a pretty good resource back there too, because she's got some door prizes for us.